So our first question is, what is your name, your occupation, and where do you work?
All right, so my name is Kay Graham, and I'm an occupational therapist, and I work at Burnell University. I'm the department chair in the Gainesville Day School of Occupational Therapy up there.
Great. How would you describe your occupation to someone who's not familiar with injury prevention or public health?
So, uh, from an occupational therapist is anybody is a professional who has gotten a degree from it's one of the allied health professions, and what we do is help people get back to doing what they need and want to do. An occupation in that case is something that's meaningful to them. So it could be a job, but an occupation is also getting dressed in the morning and that kind of thing. So we work closely alongside with other allied health professionals, such as speech and physical therapy. And we're a lot of times in medical settings, but then we're also out and about in um, mental health settings, work with a variety of clients. One of the things that we can also do is work within the community, and that's where I have interfaced with more the injury prevention folks working around fall prevention. So while we work about fall prevention directly all the time from a medical standpoint, in terms of we've got these clients and let's say that they have fallen and broken a hip or something like that, and so we see them afterwards and ensure that they're safe and they can go home and those kinds of things in terms of they can get around their house safely and while they're having to use a walker or something like that. And so that's direct fall prevention, but we can also work at a larger level, at a group level or at a population community level, in terms of ways to interface and education and that kind of thing. And that's where I've interfaced mostly with the folks with the injury prevention team in those more community levels.
Awesome. Could you maybe talk a little bit more about some of the education that you do related to falls?
Sure. So medically, so that person that I was mentioning that fell and broke their hip, we're teaching them straight out how to get out of bed safely, how to get to the bathroom safely. So those things, using their walker safely, how to get dressed, the ways to implement those techniques within their home or wherever they're going to in their next event. So we're frontline people at that point. And then let's say then that same person 3 years down the road and they're doing well, but they're starting to get a little bit more frail. We can interface with them when they're concerned about falls, and we do work together with other people in the community. We have a fall prevention coalition in my area in Gainesville, and we all work together, the Area Agency on Aging, the folks from the emergency room to the first responders to the librarians to the people that are teaching community exercise kinds of things like Tai Chi for arthritis, those kinds of things. And so at that level, what we're doing is educating folks now that aren't quite as acute or as um, really fragile state, but they're concerned about falls, and we may do fall screenings based on the STEADY toolkit, which is something out of the CDC that helps towards fall prevention. So at that level, we're educating folks about, again, how to make themselves safer, what they can do to help prevent falls, what they can do if they fall, how to interface better to take and manage their own health. So we do a lot of education, both one-on-one screenings as well as talking to a group. And in my work, what I do is I do that all over in lots of different ways. I may go to like an independent living facility that has a group of older adults that are interested about falls, and I may talk to them and do some education about the types of things that falls are preventable in many cases, and what to do about it. And then I may also screen them to see if they're at risk for falls in partnership with my other coalition members. We might go to a library, and when we go to the library, what we do there is we again, a group of people who are interested about fall prevention. Maybe they have a spouse themselves or they're the daughter or granddaughter of someone who's having falls. And we do that same process. We take them through the education and the screenings as we can, using evidence-based recommendations like from the CDC, to support those kinds of things. We have larger events like a fall prevention expo that we do once a year. And in that, what we do is we open it up to the community, everybody that's interested, and we do lots of different screenings. We also do some education. Each year we have a different theme about that education. So those are larger groups of people, and in that, I'm also educating other providers. So by being part of those groups, or even the groups that I'm presenting to, say through the libraries or through even the independent living places and that kind of stuff, I'm also working to educate to make sure that other people understand, other professionals understand where they fit in and their role in injury prevention or fall prevention, because often we're very siloed. And so I kind of look at myself, because I have a background in public health, that when I pursued my doctorate, that's what my doctorate's in. And then I have my medical background. And so trying to bridge those and bring those together, I'm always trying to, it's a multiple education, and I get educated because I learn from the people that I'm presenting to. So it's multifaceted.
That's great. What excites you most about your occupation?
So as an occupational therapist, we can do, as I mentioned, we can work right in a medical setting. We can work in a community setting, like a clubhouse for people with developmental delay. We can work in the school systems. We can work in a psychiatric hospital. We can work in a nursing home. We can work in an outpatient clinic. Or we could work in the community doing what I'm doing now, which the more community health side of things. And so there's so many opportunities. If you're bored, it's your own fault. And that's what I tell our students all the time. It's a in-demand profession, usually one of the top 10 professions in terms of salary, all of those kinds of things. And it for health professions, and top 10 health professions, but it is just a wonderful way to serve other people. And right now, it's also a pretty secure job. And so, because you can do so many different things with it. So if one thing doesn't work, then you could go and work in a different setting. Or if you get sort of burn out, about one setting, you can work in a different setting. So I think that's one of the things. The flexibility is one of the things I love most about it. And then I just, like most people who are working in sort of public health or the medical kind of things, we have that heart of being of serving others, and it's a privilege to come alongside somebody and be able to help them do something that they want or need to do, and be successful at that. And so and in regarding to falls, some of the things we do, I think, gosh, this is just common sense. And I'm surprised that it's sometimes almost earth-shattering when people think about something in a different light, and being part of that process and maybe helping to ensure somebody is doing something in a way that then helps them be safer at home or more active at home, and can make this longer impact on their health. I mean, that's just it's a privilege to be alongside those things. So
Okay, I know sometimes public health students either are on their way to medical school or maybe just finished medical school. What would you say to a student who may be trying to make a decision? Do they have to choose between medical school or public health, and how do they bring those things together? What would be your advice to a student who was trying to make a decision like that?
sure. Well, I will say, I have loved here recently, maybe the last 5 years, as we're doing admissions interviews and we're getting these cohorts that in occupational therapy, we're starting to see more of these undergrads that had maybe a health promotion major or a concentration in public health as an undergrad, and I love that. Our program is a graduate program, like most medical type of professions, and it is, you know, all of the medical allied health professions require observation hours and whatnot, and seeing what's a good fit, I think, is important. Knowing about the different professions and seeing what that means. My parents, they still ask me. I'm in my 50s. They still ask me this question: "Are you sorry you didn't become a medical doctor?" And
Mhm.
my answer is always no. And my dad asked me this a couple weeks ago again. And because that's not what I wanted to be. I wanted to be an occupational therapist. I loved what I saw way back when my grandfather had a stroke, and I haven't regretted it a single day of my profession. And so I think that when we think about sort of those next steps, it's how we want to work. One of the things with as an OT is it gives you freedom to work one-on-one, much often like at the front lines of things, but also at that sort of broader community level. And it's an added feather in your cap. Now it's several years of a program, but it's certainly, so you not only have your public health background, which may be great in terms of program development and evaluation and those types of things, or from an epi standpoint or something like that, but then you've also got this whole understanding of a person. And from my standpoint, I think why we as OTs are valued in public health and working with folks is we bring this understanding of a person that's different because of our training. We have training in psychology as well as from a physical standpoint, and so bringing all of those things together, as well as an environmental understanding of how the environment, what role the environment plays. When we work with our partners in public health, we bring something to the table that can be very useful, whether or not we've had public health training or not. But I think that when you've had that public health training and you're an OT, and then you can drop into these settings and be very effective and sought after, frankly, in terms of people wanting to work with you because you see the world a little differently from your other public health folks.
That's really great advice, Kay. I'm so glad that you said that. And we do have a certificate program at Emory. I'm sure that you're aware of the Injury and Violence Prevention Certificate. And so I wonder, and Alicia, you chime in, what would be your advice to someone who's considering the certificate? And Alicia is a first year MPH student at Rollins. So what would you say to someone like Alicia who's considering the certificate program?
Yeah, in my doctoral program, it was at UGA, and I decided I wanted to get a certificate in gerontology, and my advisor was like, "You don't need that." Well, I didn't need it in terms of the program, but going through that sustained, focused certificate program was really valuable to me because I work with older adults, and yes, I had all of my courses that I needed in terms of health promotion, which was my department, and all of those, but those added courses, they directed my focus, they focused my research, they focused my understanding. And so when I looked up what the injury prevention program was, it seems similar in terms of that in your certificate program, that you've got some focused coursework and some guidance alongside that really can hone your efforts, and whether it's research or your understanding. I think that for me, going and being more specific in that way was really valuable. And so if that's something that people are interested in, it's a niche for you. And then you also will make great contacts. I mean, the world of public health is huge compared to occupational therapy. I mean, when I went to the American Public Health Association conference when it was in Atlanta, I was like, yeah, I'm in this is like the big leagues, because AOTA, my professional organization, is much smaller than all of the public health professionals. But having those connections that are afforded by the certificate program too, I think would be invaluable, whether it's from where you might work in the, I'm not sure what the term is, the field work, is that the right term that you guys use? The practicum, those kinds of things that can totally, I would think, set you up in terms of your understanding and knowing someone that could help you later, knowing how things work within the state. All of that I think is really valuable. So to me, it would be, if it's an interest and it's not that much extra time, I think it would be a great idea to really focus and hone and see if it's the route that you wanted to go. And we have some great leaders in the state around the injury prevention that are super at mentoring as well. So I think that you would be pleased should you choose it.
If you're interested in applying to the IVP certificate, then email Dr. Dorian Lamis. You can also learn more about the certificate by visiting us on our website or social media.